How long is your morning routine?
A minute and 30 seconds. No, it's 15 minutes, 15, 20 minutes.
Okay. So some people's are a little bit longer. So we're gonna react to a morning.
Like 3 hour routine?
Oh, not quite that long.
Okay,
We're gonna react to a little morning routine video today and
let's see
see
how
what
it
you think.
goes.
Yeah.
Okay, I saw the side sleeper pillow like
I
that.
do like that.
hmm Lymphatic massage, stimulate the flow.
Hmm. Ooh, a little
She
gua
used,
sha. We
okay,
like the gua sha.
oral care is important. Lip mask, brow treatment. Okay, yeah.
I thought about getting one of those vibrating boards.
Love the LED panel. I will
Cute.
say I'm glad she didn't do her full like routine for makeup or moisture or like exfoliation right before her workout. So she
Yes.
has some fatty acids, probiotic, and
Tea.
energy drink. Okay, she's going to the gym.
Okay.
Good for her for waking up at 5:45 to go to the gym.
Yeah. Okay.
And then she has supplements
Maybe like
before her
collagen.
meal.
Oh, I see. Oh, electrolytes
I think those are creatine gummies,
and
NAD
NAD.
shots. I don't know about the olive oil shot. Is that for digestion?
I'm not sure. I'll have to look that one up. Maybe just for some
Collagen.
good fatty acids.
But she took fatty acids in the morning though already.
That's true. Hair supplement. I need that.
Dry brush, but she already did lymphatic. Well, I guess that's for more exfoliation.
That's funny.
Body butter. Okay, great.
Mm. Oh, nice.
Growth factors. Need that. Antioxidants.
Vitamin
Got it.
C, yes. Sunscreen,
Mm-hmm.
absolutely.
Beautiful. Okay, so she also
Okay.
has sheet mask,
Sheet
lip
mask.
mask, fake mouth tape. Is that mouth tape?
I think a mouth tape, and then just like a sleeping bonnet.
And a sleeping bonnet.
Alpha hydroxy acid
I will say, I don't
or
think that,
hyaluronic acid.
and hyaluronic acid serum to hyaluronic acid?
I just don't know what that is it HA serum, I think?
AJ serum.
I don't know what that metal thing is though.
Was it not a gua sha tool?
It looked like it had something to do with like her mouth.
Oh, the tongue scraper.
It's a tongue
It's a
scraper.
tongue scraper.
Okay.
Yeah, yeah, yeah. I have one of
I
those.
haven't seen one that looked like that.
Okay, so pre-workout we already said. But see, she did fatty acids already.
It pops up so quickly it's hard to see. Okay. Oh, that's so early.
I will say, I don't think that I would personally. I wouldn't wake up that early,
Mm-hmm.
but if I had a routine and if I had a regimen that looked like that, that's what it would be for me because I
Mm-hmm.
already take the supplements, but I'm not super consistent with the supplements.
Yes.
And doing the lymphatic, I think I'd probably add more like stretching for me personally in that regimen. If I
Mm-hmm.
had the time, if I didn't have to be at work at 7:30,
Yes.
that means I'd have to go to bed a little bit earlier. But I do like that routine. She's a nurse practitioner, so
Mm-hmm.
she knows
Yeah.
what she should be taking. It looks like she knows what she should be taking, so that's a great plus to have as a medical provider or medical expert, I would
Yeah.
say. Um, I love the NAD shots. It's always like
Yes.
anything preventative.
Yeah. I'm very intrigued by that and I want to pursue that more. I got some NAD supplements, but I'm not sure if they're super bioavailable.
hmm
I kind of I was super excited about it. I got them and then I heard some negative things about like they can cause some stress in the body and not really be like bioavailable enough to do much.
hmm
So I want to try some different ones and maybe like
Yeah.
the shots I've
I
heard are the
figure
most.
the shots are the
Yeah.
more potent and
Mhm.
way to get it. I have heard that too.
Yeah.
So versus, although there are some brands that say, "Oh, we've made it to where it's you're able to break it down better and absorb it better." I
Mhm.
don't know if it's true or accurate or not, but I would go for the shot. But
Yeah.
the shot every day, I don't know.
I don't think you have to do it every day.
Oh, really?
I think it's well, I think there's one that's like an IV you can go get, and then there is a shot.
I thought the IV was painful.
I've heard it is painful, but
Like
if it
it's,
works,
yeah, you're right.
I don't know.
You're right. But some of the benefits is more for NAD would obviously be more like preventative, cell
Hmm.
damage, things like that. So you age slower, performance enhancement as well. So
Yeah,
your
more
mhm,
energy,
things like that.
mental
So
clarity, probably.
yeah, so great regimen. I
Hmm.
see why you look the way that you do.
Yes.
You definitely want to avoid using any kind of actives during the before your workout. I would say
Hmm.
any actives because you don't want to irritate the skin.
Hmm.
So she just did a simple, I think after her gua sha, I assume she washed her face, but she just did like tinted SPF and
Hmm.
then got ready for the gym.
Yeah.
So that was a really good thing for her.
Yeah. As someone with kids, I'm like so jealous when I see something like this. I'm
Mhm.
like, ah, this would be so
She had
nice.
a
Like to,
disclaimer.
I know, I know.
What did you say? 31-year-old, no
No
kids.
kids. Because she knew everyone with kids is gonna be so jealous. Like,
Hmm.
ah, I
Hmm.
wish I could do that.
Hmm.
Um,
But
but
I have no
maybe,
kids, so and I don't do that.
or maybe when my kids are a little older,
Have the time to do
I can
so.
have the time to do that because it is nice, and she's probably doesn't do it herself every day, but she's showing kind of like all the things that we should try to like in an ideal world,
Hmm.
all the like high points to hit in the morning.
Yeah, I just started stretching in the morning, so I mean, I should have been stretching in the mornings because it wakes up the body a little bit more,
Mm-hmm.
and you want to go ahead and start releasing some of that tension from like being stiff all night. I mean, I wake up stiff, so what she was doing with lymphatic drainage and like stimulating that flow,
Mm-hmm.
which ultimately makes your body feel more limber, more lightweight because
Mm-hmm.
that fluid is moving and that blood is circulating. She also did dry body brushing, which is great for the lymphatic system, but it's also a great
Yes.
way to kind of like remove some of the dead skin off the
And the
surface.
vibrating board
And the
is good
vibrating
for
bar. Now, you don't
lymphatic.
need the vibrating board, although it'll be easier, but there's
Mm-hmm.
certain like movements that you can do I've seen, and then just
Yeah.
like the pats on the body can also
Mm-hmm.
stimulate or give you that same effect. Or if you just want to have it,
Yeah.
while you're vibrating on the plate, the LED panel. Remember what was
Mm-hmm.
that brand that you sent me? Juve?
Juve, I think. Yes.
They're pretty pricey, but they have
But
a high
really good.
quality
Yeah.
LED. So I think that was plus. I mean, if I had a closet as big as that, yeah, I'd put everything in there.
Oh
Yeah,
yeah,
you saw her closet.
definitely.
So great job on the routine.
Yes, and we'll try to review another, like probably another routine soon. Maybe a morning routine, maybe a
Hmm.
night routine. It's kind of fun to see what other people are
Yes,
doing.
I will say disclaimer. Always like I know we watch things online all the time and we want that and we take it and we just because they use it, we want it. With when it comes to supplements, I would highly recommend speaking to a medical provider
Hmm.
because some things cancel each other out, or you might be taking too much of the same thing that can cause like drowsiness or can cause you to faint and things like that, where you're taking too much either melatonin or you're taking too much magnesium and you're taking too much ashwagandha,
Hmm.
and then all of that just can cause a lot of issues. So speak to a medical provider first. Don't just buy what you see
Yes,
because
and
someone else is using it.
yes, especially if you're taking prescription medications, there's some that can cause the medication to not go through your system as quickly or take too long to go through your system and cause like an overdose. So it is definitely
Mm,
important to talk to a medical provider and get some good insight. They
absolutely.
might, they can't necessarily recommend certain supplements because they're not approved by the FDA, but they can kind of give you some gentle guidelines.
And
Um,
when to take them and
yes,
how far apart to take them.
yes, because you also don't want to take them all at once and cause maybe some stress to your liver.
That was something that I was doing. I was just like, well, I'm taking my vitamins, I'm taking them all at the same time, but it's like, no, there's a reason why you take it with food or without food because
Hmm.
of the fat soluble, it doesn't either pairs or it doesn't, and or it upsets your stomach or something.
Yes.
or you have to take it with a few hours in between, because then it can cause like an overdose of that certain thing, which can cause kidney, liver issues because it's too much for your body to handle at once. So
Yes.
I had to learn, not the super hard way, but I did do my research after that, and
You're
I
like, whoopsie
found some.
poopsie. Yeah.
Yeah, because you're paying all this money for supplements, and then
Mhm.
you're just not taking them how you should, and then it's just money gone to waste, and you're not seeing the results.
Yeah.
So,
Yeah. At the least, but maybe it's just like you're peeing it out. At the worst, it's causing damage. So.
so always speak to a medical provider.
Yes. So we'll talk to you soon.
Enjoy.